Welcome to Chillin' 101. We hope this video helps.
You stop talking now and prioritize rest. Absolute silence for the next 24 to 48 hours to reduce swelling. While you rest, drink 8 to 12 cups of warm fluids and avoid caffeine or alcohol because they dry the vocal folds. Use a humidifier set to 40-60% or inhale steam for 10 minutes twice daily to loosen mucus. Once done, keep movements gentle, no throat clearing or whispering, which stresses the cords. These first steps lower inflammation and prevent further damage. You now begin active, controlled recovery with gentle vocal exercises to reintroduce phonation. Start with lip trills and humming for 3 to 5 minute sessions, several times daily, because they engage the folds without strain. Take anti-inflammatory measures as needed, ibuprofen 200 to 400 mg per dose unless contraindicated, and apply ice to the anterior neck briefly to reduce swelling. Make sure to use diaphragmatic breathing and open throat alignment so airflow supports the folds. You complete recovery by gradually reintroducing normal voice use over 3 to 7 days, increasing duration and volume only as long as there is no pain or worsening hoarseness. If symptoms persist beyond 2 weeks, or if you experience sudden loss, blood, or significant pitch change, make an appointment with an ENT or voice therapist immediately. If things go wrong, reduce use, return to silent rest, and seek specialist evaluation. Acting early prevents chronic injury and speeds true functional recovery.
Thanks for watching. Consider subscribing if we helped you.